talk about amplifying, talk about hyperbarics and how it can really amplify many of the therapies that you guys are very familiar with. Um, by way of background, I am medical director of a freestanding hyperbaric practice. We have two locations here in Florida, one in Fort Lauderdale and one proud medical director of the Biohack lab, for whom we have the pleasure of eating the lunch that they provided. And they also have a soft chamber out in the vendor area, which I encourage you to check out. When it comes to peptides, obviously, this is an evolving space when it comes to regulations. So I think it's important to understand that many of the peptides I'm going to discuss aren't currently available from compounding pharmacies, at least in an FDA-approved manner. But that's evolving, and recently we heard that RFK is planning to take many of these category 2 peptides back into the category 1, which is amazing, and hopefully will expand access. But ultimately, the onus is on you as providers to ensure that you're providing your patients with safe, pure, potent product that's legally sourced. So we're going to do a brief overview of HBOT, hyperbaric oxygen therapy, talk about some mechanisms, and really highlight how the mechanisms for benefit of HBOT really line up extremely well with the regenerative medicine modalities as well as peptides. And I'll finish up with some cases explaining it. So we know what synergy is. It's basically the interaction between two agents where that the combined effect is greater than their individual effect. And so I'm going to identify these categories where not only regenerative medicine, but also peptides and hyperbarics could really play a role. So we're going to speak about tissue repair, wound healing, immune modulation, mitochondrial health, brain health, and of course, longevity. So a few high-level concepts: pleiotropic. Peptides are highly pleiotropic. You'll see several peptides that we'll discuss that have multiple cell type and tissue effects. I would actually argue that oxygen is probably the most pleiotropic molecule. We all know it as a substrate for cellular respiration, but it does so much more. It's a regulator of the mitochondria. It helps support immune system modulation. It actually helps determine the type of macrophages that polarize, whether they be inflammatory or anti-inflammatory. Catalyst for repair. It's a neuroplasticity driver. It's a regulator of performance, epigenetic switch, signaling molecule involved obviously in redox. So it does so many things, which is why if we have therapies that can help modulate oxygen, we're going to have multiple different benefits. So it's really, I like to think of it as a biologic master switch. And so as we age, we start to lose some oxygen reserve and adaptability. Anyone who's ever taken care of an elderly patient, especially in a critical situation, they drop their sats very quickly. And so if we can find a way to improve this adaptability to oxygen, we're ultimately going to see an improvement in biology of regeneration and therefore aging. Now, a lot of people have this understanding that oxidative stress is bad and too much oxygen therefore is bad. This is an oversimplification, and it's true. On the extremes, either it would be hyperoxia or hypoxia, we're having lots of harm. However, if we can toggle back and forth between hypoxia and hyperoxia, we can leverage many of the benefits of oxygen. So similar to what Dr. Parita was talking about, hyperbarics operates on this principle of hormesis, where if you apply the appropriate amount of a stressor, in this case oxidative stress, you're going to see a beneficial adaptation. So it's the same concept that you can apply to exercise, heat and cold exposure, training at altitude, etc. So the key is to find the right stimulus, because obviously everybody's at a different place on that continuum. There are some patients that I treat who can definitely not tolerate well high levels of oxidative stress. They get very fatigued. They can even have Herxheimer reactions. And so you really have to be able to individualize the therapy towards the patient. All right, so what exactly is it? Well, the formal definition is that it's an inhalational therapy using 100% oxygen within a pressurized chamber. And we measure these in something called atmospheres absolute, or ATA. Now, this is the textbook definition, and they had set 1.4 ATA as the cutoff. But we know now from plenty of studies that at pressures lower than this, we still see benefit. So why would we incorporate pressure? Well, we know as far back as the Old Testament that areas that are higher in pressure, the Dead Sea, which is 1,400 feet below sea level, which is 1.1 ATA, there's actually more oxygen dissolved in circulation due to Henry's law. And so it's not just the water at the Dead Sea, but it's also simply the pressure of the environment that portends the benefits. Whereas Mount Everest is the opposite. You've got about a third of the oxygen, third of the pressure, and so not compatible with life long term. If you get into an airplane, those are pressurized to 0.75 ATA. So we're subsequently seeing less oxygen in circulation, which explains why a lot of us feel lousy when we fly. So as far back as the 1600s, leveraging this observation that pressure has been associated with better health outcomes, the first chamber was built in 1662, even before oxygen was discovered. During the 19th century, hyperbaric chambers were used to treat bridge builders who would develop the bends. So that was a more of an industrial use of the modality. But fast forward today, we've got much fancier chambers, but even more importantly, a much better understanding of what happens to you when you're in a hyperbaric chamber. The picture on the top left is my center in Miami. Those are what are known as monoplace chambers, single person chambers made of acrylic. The top right is a multiple person chamber. This is at Mercy Hospital right down the road. They treat a lot of scuba divers. And the bottom right, an example of a soft chamber. You'll see one out in the vendor area. So all of these have potential for benefit. I'm excited about the advent of these concentrator-driven hard-sided chambers. I think these are really going to expand access, because that's a big issue, is access to the therapy. And so we're starting to see these come down in price, and these are on par with many of the medical grade chambers. So a more nuanced definition was proposed by Dr. Harsh. He's kind of considered to be the godfather of off-label hyperbarics in this country. He calls it a pressure and oxygen dose-dependent biological paired gene therapy. It's a mouthful, but basically most of us are familiar with hyperbarics in promoting wound healing. And the way it does that is by turning up the regenerative genes and the anti-inflammatory genes and turning down expression of pro-inflammatory and pro-apoptotic genes. And so which genes are impacted depends on different combinations of pressure and oxygen. So epigenetics really explains a lot of the modalities that we use. And about a third of the human genome is affected by the hyperbaric environment. And the net effects are that the antioxidant genes get turned up, things like superoxide dismutase and RF2, the healing genes, if you like. So the VEGF, platelet-derived growth factor, BDNF, so affecting neuroplasticity, these all get turned up. And the inflammatory genes, genes responsible for the inflammatory cytokines, IL-1, 6, 8, TNF-alpha, they all get turned down. So as far as how we get very high oxygen, the way we normally deliver oxygen in our body, I'm taking a breath of air, which has 21% oxygen. That's sufficient to bind with the hemoglobin on the RBCs in my lungs and get taken out to the cells and then the mitochondria. The thing is, I am pretty much close to saturation with that system. I take several deep breaths, I can easily get to 100%. So just giving someone supplemental oxygen, it's not going to have much of a benefit. The key is incorporating pressure, because through the laws of physics, when you breathe oxygen under pressure, you're pushing oxygen to plasma. Sitting here, we all have about maybe 2% of our total oxygen in plasma. You get into a hyperbaric chamber, that number goes over 20%. And so we're creating a new rule for plasma, which is oxygen delivery. And the benefit of that is that an oxygen molecule dissolved in plasma is much smaller than an RBC. So it's very simple. That's smaller than the RBC allows it to diffuse 4 times further, deeper into the tissues. And so the cells are going to see up to 1,200% higher oxygen. So what's the impact of that? Well, a colleague of mine, Scott Scher, has kind of created this framework between short-term and long-term benefits. So in the short term, you have a whole host of things that are going on. Obviously, we're raising oxygen. There's a potent anti-inflammatory effect. We're going to discuss its effect on stem cells. Obviously, the electron transport chain is using oxygen at that last complex for ATP generation. The immune system is impacted, autonomic nervous system. So many immediate effects. And in the long term, this is where you typically are in a protocol, usually considered at least 10 sessions, oftentimes between 20 and 60 sessions. You're seeing several things that are more durable, angiogenesis being one of the most important ones. We see more mitochondria, continued epigenetic changes. We see there's a senolytic effect as well, and of course the effects on wound healing. So why would we combine hyperbarics and stem cell? Well, hyperbarics on its own affects stem cell biology. So what it does is it causes stem cell mobilization and recruitment from the bone marrow, And we have studies showing that after one treatment at 2.4 ATA, we are seeing doubling of circulating stem cells, and that number can go as high as 8 times after 20 sessions. Not only does it stimulate the number of stem cells, it's impacting the secretion profile of growth factors, the differentiation. So on its own, hyperbarics actually has a major impact on stem cells. These are some of the studies. In general, the deeper the pressure, the higher the stem cell mobilization. And I put this in here because we also know that you can see stem cell mobilization even in soft chambers. So this study took healthy volunteers, treated them for 10 sessions at 1.3 ATA with no supplemental oxygen, just air. And they found that after 72 hours after the 10th treatment, that there was a 3-fold increase in circulating stem cells. So this is hugely important. Number one, not only because it shows that there is utility to the soft chambers, but more importantly, if you ever look at hyperbaric research, a lot of times you'll find conflicting results between studies. Oftentimes, the placebo arm in an RCT is treated at 1.3 ATA. So if you're treating someone at a so-called placebo and that placebo has major impact, it's not a placebo. So I think it's important to recognize. So what are some of the factors that influence stem cell therapy and its success? So obviously the quality and the volume of the cells, the viability and the potency. Also the host matters. What's the environment like? How well can those cells home and engraft? And how balanced is the immune system? How balanced is the oxidative stress capacity? So what are some of the factors that influence homing? Well, there are these 3 issues: chemotaxis, adhesion, and transmigration. These are basically all helping to guide these cells to the site of injury. And there's a rationale to therefore use hyperbarics because hyperbarics is basically supporting all 3 of those components. And so if you were to give it before, you can improve the homing cues as well as increase your own circulating stem cells. And then HBOT after stem cell therapy is going to support engraftment. So there's this concept of prime, home, and protect. You would prime the body first to increase antioxidant capacity and decrease inflammation. You're going to post, allow for better trafficking to sites of injury, and ultimately you can help protect these cells' viability and essentially make the soil more receptive to transplanted cells. So different slides basically saying the same thing, and the bottom in the yellow helps identify the different mechanistic pathways by which this works. And so, yeah, this would be, if you want to look for the most evidence-informed. Now, clearly we don't have a lot of studies actually identifying this, but based on the evidence we have, the idea would be to do one hyperbaric session within 24 hours prior to the regenerative medicine procedure. Then you do the infusion or the treatment, and ideally you're going to do at least 3 sessions post. And ideally treating at 2.4 ATA, so a medical grade chamber, you're going to see the highest results. But again, as that study demonstrated, even in a soft chamber, if you do enough sessions, you are going to increase stem cell numbers and secretion. Okay, peptides. So peptides are amazing. They're all the rave right now. But you know, they're ubiquitous in our body. It's kind of like talking about proteins or cholesterol. I mean, there are things that have been existing in us. And essentially, these are small chains of amino acids. Traditionally, it was thought somewhere between 2 and 70. The FDA kind of came up with a very arbitrary distinction of 40 amino acids or less. But essentially, they're signaling molecules, and they're found within us. And they're really, what's great about them is they're speaking our body's own language. So they bind to known receptors in our body. They're very short acting. They're typically broken down in the bloodstream, so you don't have to rely on the liver or the kidney for metabolism removal. Majority have to be injected because they're very unstable molecules. They won't survive the stomach. But the upside is that a lot of these internal feedback loops are maintained, and so you're not going to run into issues with toxicity or adverse effects as much as you would with pharmaceuticals. We know insulin is probably one of the most well-known peptides, discovered over a century ago. Glutathione is also a peptide. So I like to think of peptides in big categories. And so the first category we'll discuss is tissue and cellular repair. So again, hyperbaric is very well known for its wound healing effects. It supports all 3 phases of wound healing. We're talking about inflammation, proliferation, and wound remodeling. Not only does it increase stem cells, as we discussed, it's going to support fibroblasts and new collagen, chondrocytes, osteoblasts, osteoclasts, and growth factor signaling. So it essentially helps create the scaffolding for new tissue. I also mentioned angiogenesis. This is a key reason of how I can help patients with diabetic foot wounds at risk for amputation. It's really the microvasculature that improves over time with repetitive hyperbarics. Anyone who's ever looked at an MRI of one of your patients in their 50s and older of the brain, you see these microvascular ischemic changes. So if we have a therapy that can improve microvascular circulation, it's going to have great utility. Interesting enough, it's not just the high oxygen that really drives this. It's actually elucidated through this pathway called HIF-1 alpha. So a hypoxic inducible factor is triggered by hypoxia, as the name implies, and that's what drives angiogenesis, stem cell release, mitochondrial biogenesis. But we don't want to make our patients hypoxic. So what we do is we make them hyperoxic, uh, and then periodically they're going to go off their supplemental oxygen. And in a medical grade chamber, that comes in the form of periodically breathing through a mask that's connected to medical air. So you're going from FiO2 of 100% down to 21 just for 5 minutes, and back up to 100. So we're toggling back and forth. And it's during the downsloping segments where HIF-1 alpha is being stimulated. And of course, if you come out over 30 minutes, you're going back down to baseline. So you've got multiple times where you can trigger this pathway. There's studies looking at skin rejuvenation in hyperbarics. So hyperbarics can affect both intrinsic aging of skin as well as extrinsic associated with UV light exposure. And so we see improved collagen density, improved fiber elastic length, as well as improvement in blood vessel density in the skin. And we're going to talk about a peptide that does very similar things. All right, so this would be the category of peptides that are in this kind of cellular and tissue repair group. I'm going to focus on the top three. Thymosin beta 4. So I spoke about pleiotropy earlier. This is a highly pleiotropic peptide. We find it in multiple cell and tissue types. It's basically in all cells except the RBC. And it's got multiple activities. And so it can upregulate actin. It can impact migration to injury sites. It's going to accelerate wound healing through the MMP expression. It also promotes angiogenesis, also anti-inflammatory, promoting stem cell maturation. So you're going to see a theme of these are very similar to the mechanisms of hyperbarics. It's a potent antifibrotic, which has great implication for kidney failure, liver failure, post-MI in the heart. So there's multiple areas where we can ideally use these. Wound healing, musculoskeletal repair, immune support, cardioprotection, brain injury, even ocular indications, and NAFLD. It's a quick slide on dosing. I'm not going to get into too much dosing. This is probably the most well-known peptide these days, BPC-157, body protection compound, and is another very pleiotropic molecule. It's actually made in our gastric contents, and the reason the slide is up there is Dr. Pavlov, when he was doing his experiments on dogs, also isolated the gastric juices of dogs. And somehow he decided to start giving this to patients, and he discovered that this had great healing effects on things like ulcers, gastritis, even anemia. But it wasn't until 1993 that the active compound was isolated, and that's BPC-157. So we see it modulating angiogenesis, again, overlap with hyperbarics. We see it increasing stem cell production, potent anti-inflammatory. It actually has an impact on growth hormone itself, cardioprotective, as well as gastroprotective. So we can see a whole host of areas where BPC-157 could be used. Pentadecapeptide is basically an arginine on BPC-157, so that's how compounding pharmacies got away around some of the FDA restrictions and still getting to use this molecule. If we give it orally, the idea is that it's going to help target the gut lining. It can be given intra-articular, subcutaneous. I've even seen some protocols for IV. GHK copper, also known as the copper binding peptide. So this one is really associated with skin health. We'll find this in a lot of topical cosmetic products. And it's going to do many of the things hyperbarics does. It promotes skin angiogenesis, skin elasticity, affecting both intrinsic and extrinsic aging. Great for wound repair. There's some applications for hair growth. Also some kind of longevity benefits, antioxidant, neuroprotection. It's one of the few peptides that tends to burn when you administer it. Topically, it's also has lots of different potential for use. So let's talk about the first case. This was a 56-year-old. She was referred to me after a tummy tuck by her plastic surgeon, and she developed ischemia of the abdominoplasty incision, which resulted in necrosis. And we found out later that Her former smoker wasn't really so former. She had continued to smoke, which is likely what resulted in a lot of this complication. So we got her started on hyperbarics. Insurance covered 30 sessions. After about 10 sessions, she had some improvement, but wasn't getting where she wanted. So we implemented this combination of these three peptides: GHK copper, BPC-157, TB500. Many people know this as the glow stack. And so the slide on the left shows before implementation of peptides. And over the next 3 to 4 weeks, using both peptides and hyperbarics, she had great outcome. Another case involved an Achilles tendon rupture. So many of you know probably some of the BPC data in rats. They're severing an Achilles and then using BPC just to that on its own, not surgery. So I treated a 40-year-old triathlete. This guy was very active, high-level athlete, but he had the classic weekend warrior injury, ruptured his Achilles playing basketball. And he was really pressed to try and recover quick because he had a race in about 3 to 4 months. So in addition to, he did the surgery, of course, but we combined hyperbarics together with BPC-157, TB4, and some of the growth hormone secretagogues. And he had amazing response. He was able to compete in that triathlon. His physical therapist couldn't believe it. And he actually had a personal best in that triathlon. All right, so the category of immune modulation. So hyperbarics' major impact on the immune system. Specifically, it's going to downregulate pro-inflammatory factors, TNF alpha, which are targets of a lot of these biologics that we know, steroids as well. And it's going to upregulate the anti-inflammatory factors, things like IL-10, especially in IL-4. So you're really getting the best of all these medications without any of the adverse effects. And we also know that it has an impact on senolytic cells. I mentioned earlier its impact on macrophages. So it has a really foundational role in supporting the immune system. There's a lot of emerging studies showing that it can play a major role in autoimmune disease like ulcerative colitis and Crohn's. And this meta-analysis looked at 19 studies with over 800 patients. And they basically concluded that obviously HBOT is safe, but it was associated with substantial rates of clinical remission for multiple inflammatory bowel disease phenotypes. And this not only, we think, impacts the actual mucosa, but also the microbiome, which is another key component of healing the gut. So what would be some of the peptides that we could pair with this that could help modulate the immune system? Well, essentially, they're going to be the thymosin, and main one, we already spoke about thymosin beta 4, but we'll talk about thymosin alpha 1. So these are small molecules coming from the thymus, and most of us know that when we're born, our thymus, if you look at an x-ray of an infant, the thymus is as wide as the heart. But when you get to middle age, that thing is involuted, and certainly the more we age, the more it shrinks. And what the thymus gland is really doing is, think of it as a school for our immune system, specifically our T cells. It's helping to teach our T cells what is self, what is not self, when to attack, when to stand down. And the loss of this function explains much of what we see with age. We see a rise in cancer. The immune system is playing a vital role in surveilling against cancer. We see a rise in autoimmunity, chronic inflammation. It's why the elderly tend to succumb to viral infections, right? It's this loss of immune system function. So thymosin alpha 1 is secreted by the thymus gland, and it helps restore some of that balance. Think of it as taking your immune system, your T cells, back to school for a refresher course. And it helps enhance cell-mediated immunity. It's immune modulatory, so it's not mindless, just revving up of the immune system. It's intelligent in its balance, antiviral, antioxidant, and theoretically anti-tumor properties. Not FDA approved here, but in other countries it is. And we see its use, again, across a range of different conditions, sepsis, immune deficiency, mold exposures, hepatitis C it's on label for in several other countries. So a great peptide. I personally use this anytime I find myself coming down with something, and I find it to be a very useful peptide. So this is another case I had. There was a 32-year-old female with a history of Crohn's, chronic fatigue, long COVID, and she had used HBOT in the past for chronic fatigue. And she came to us because she had a really horrible flare of her Crohn's. And she was one of these people who could not tolerate steroids, could not tolerate biologics due to all these adverse reactions. So we not only gave her hyperbarics, but we also treated her with peptides. So we gave her TB4, thymosin alpha 1, and BPC-157. And she did really well. Within about 3 weeks, she had resolution of her symptoms, and we completed her, and she has remained in remission 2 years since that episode. All right, mitochondrial peptides, very important category. So this is a super busy slide, which I try and avoid, but in general, I put this up here to show that how hyperbarics can impact not only free radicals, but the mitochondria. So one hyperbaric session, you're actually ending up in a net increase in reactive oxygen species, but starting from the next session, you have all these compensatory pathways. So the sirtuins are activated, PGC1 alpha is activated, HIF1 alpha, causing more mitochondrial biogenesis, and then more free radical scavengers, which have longer half-lives than the reactive oxygen species. So your net impact is more mitochondria and better antioxidant capacity. So we see studies of showing an increase in brown adipose tissue. This is why people get into cold plunges. We also see a significant improvement in insulin sensitivity with hyperbarics. Oftentimes, it's one of the reasons why I have to check sugars on my patients who are diabetic, because we can see a drop of up to 30 points. And over a course of treatment, if they're eating correctly, the hemoglobin A1C almost always goes down. So what are some mitochondrial peptides we could use? MOT-SC is an amazing peptide. It's a mitochondrial-derived peptide which stimulates AMPK. What's this going to do? This is going to increase our glucose uptake and utilization, therefore improving insulin sensitivity, increasing fatty acid oxidation. A lot of people have held it up as potentially an exercise mimetic. I definitely never think peptides do the work for you, but they do make the work more effective. And so we see basically an improvement in metabolic flexibility. A lot of people kind of simplistically think of this as a way to kind of tone down, and it can have that benefit, but I think it's much more foundational than just subcutaneous fat. Dr. Purita spoke about this peptide, which I'm a big fan of, SS31. It's actually one of the few FDA-approved peptides. It's FDA-approved for Barth syndrome, which is this mitochondrial issue in children. And it binds to cardiolipin, as he stated in the previous lecture. And this helps stabilize the inner mitochondrial membrane, which means that the electron transport chain is going to function better, so better ATP production, without the same ROS and oxidative stress production. So you're really kind of getting the best of both worlds. I have seen really good effects with this in some of my patients who cannot exercise. So I've treated several Parkinson's patients with this, and they really saw the benefit, not only in their metabolic flexibility, but in their overall energy levels as well. So big fan of this peptide. So this was another case of a 58-year-old. She had really diabetes, not borderline diabetes, and her PCP started her on semaglutide. And of course, following the package insert doses, it was too much, that starting dose was. And so she had lots of adverse effects. She had no energy to exercise. So she wanted to try hyperbarics because she had heard about it helping with energy. And we decided to switch her from semaglutide to tirzepatide at a much lower dose, giving her time to acclimate. We also started her on MOD-SC, got her up to 5 milligrams twice a week. We also used oral BPC-157, TB4, and something called KPV, which is a potent anti-inflammatory peptide, to help address her gut. And she did great. Started exercising, had the energy to exercise, lost a lot of weight, and is now back into normal A1C range. All right, neuroregeneration. Hyperbarics can definitely be used to help the brain regenerate. TBIs, concussions, are a great indication for hyperbarics, in my opinion. So we know the mechanisms involved in a concussion involve the shearing of axons, which are going to result in ischemia, hypoxia, edema, inflammation, and impaired regeneration. Now, hyperbarics can address all of that. It can reverse hypoxia, decrease inflammation. It induces angiogenesis and improves neuroplasticity through the upregulation of BDNF. Even there's some ideas that it could enhance neurogenesis, and we really don't have any FDA-approved treatments for TBI at this stage. So I think it's a no-brainer to use it. These are some of the trials showing how HBOT could address not only acute TBI but also chronic TBI. There's even the idea of using it in stroke as well. And again, we know that around the ischemic penumbra, that's really where you're going to see the benefit and the potential for recovery in stroke. And this study was around RCT that looked at patients up to 36 months post-stroke. and 74 patients in total, and they concluded that through increased cerebral perfusion through angiogenesis, as well as increased neuroplasticity through BDNF, essentially the brain was able to work around these infarcted areas, and it really established that you could still achieve neuroplasticity long after an acute brain insult. All right, what about some neuroregenerative peptides? When cerebral lysin is very interesting. It's actually derived from pigs. It's a mixture of several different peptides, and it helps, again, very synergistic with hyperbarics in that it helps increase BDNF, neurogrowth factor, NGF as well. It's actually on label in Austria, Germany, several countries in Europe, not so here. But over there, it's used post-stroke, post-concussion, and even some off-label use for dementia. This is the last case I had. So this is a 59-year-old female. She was involved in a devastating MVC back in 2022, and she had diffuse axonal injury, grade 3, which is the worst grade. And so essentially, the neurologist told her husband that she's not going to be much more than vegetative. And lucky for her husband not only was wealthy, but he was also very much an outside-the-box thinker, extremely intelligent. And so he took her all over the world. She got Muse cells in Asia. She did lots of hyperbarics, lots of different regenerative medicine modalities, and of course incorporated peptides. And he used a lot of cerebral lysin on her, BPC-157, TB4. By the time I met her early last year, she's walking, she's talking. Now, of course, you can still see some residual effects of the TBI, but nowhere near what you would have expected with someone with grade 3 diffuse axonal injury. So quite a case. Longevity, quickly talk about that. So we know about the 12 hallmarks of aging. We see shortened telomeres, genomic instability, epigenetics doesn't work as well, mitochondria don't work as well, our stem cells get depleted, we have chronic inflammation, rise of senescent cells, and dysbiosis. If you track all these things, hyperbarics can impact at least 8, if not 9 of those things. So it makes sense that we could use hyperbarics in aging. This is the one study that gets pointed to a lot, the Israeli study by Dr. Efrati, showing the lengthening of telomeres and a decrease in senescent cell populations. That was a relatively small study, but it still was one of these first signals to explain what we think hyperbarics could do for aging. So hyperbarics is a senolytic and a senomorphic, so it is going to certainly help with senescence. And not only on the molecular level, but also on the physiologic level. We see hyperbarics having potential for improvement in brain function, cardiac function, skin function, etc. All right, last quick talk on the longevity peptides. So epitalin or epithalin is pronounced differently depending on which study you look at. But this one stimulates telomerase. Telomerase is the enzyme involved in the length of our telomeres. And so we know with age, we see a shortening of these telomeres. And so the protocol developed by the Russians is 10 milligrams intramuscularly for 10 days every 6 to 12 months. And I have several patients who have done this. There's also some senolytic peptides that have some potential as well. FOXO is one of them. So last slide. Hyperbarics has multiple overlapping mechanisms for action between both peptides, stem cells, exosomes, and my experience has been I see faster and better responses. And obviously we still need more studies, but I do think it's a great amplifier. That's it.